name's Hannah. I'm a student of physical therapy. I'm going to be working with you today.
All right.
How you doing?
Doing okay.
Yeah?
My back's hurting a little bit.
Okay, I'm sorry to hear that. Before we get started, can you just confirm your name and date of birth with me?
Yes, my name is Drew, and I was born June 2nd, 1949.
Awesome, great. So you said you're having some back pain.
Yeah, some back pain.
Okay.
A little bit in my leg as well.
All right, well, we're going to take a look at that some more, but first I'm just going to go ahead and check your vitals. So if I can just have your finger, we're going to check your oxygen levels and your heart rate with this.
Okay.
And then we'll take your blood pressure afterwards.
All right.
Okay, you're at 99% oxygen saturation, which is great, and your heart rate is 68. Both of those are within normal limits, so
Awesome.
nice and healthy there. So I'm just going to take your heart rate real quick.
Okay.
So I'm just going to go for a little bit and time it.
All right.
Okay, great. Got your heart rate at 74 beats per minute, and I also was checking your respiratory, and you're at 16 breaths per minute, both of which are in your normal values, so
Okay.
nice and healthy there.
All right.
Great.
Good.
Just going to take your blood pressure next. You mind just holding your arm out for me? Actually, I'm going to find your artery first.
Okay.
So I'm just going to poke around here for a second. Okay. And just lift up for me.
Okay.
You ever had physical therapy before?
Nope, this will be my first time.
First time? Oh,
Yeah,
first time, this time.
I know.
All right. Just grab my stethoscope here.
All right.
And you should feel a little bit of pressure once this starts blowing up.
Okay.
Okay. Okay. Got 114 over 68. Pretty healthy.
Okay, good.
Within our normal limits.
Good.
Alrighty. So, let's see. Let's get started. So, you said it's your back pain that's brought you in.
Yes, it's my back, and I'm having some pain in my right leg as well.
Okay, so it's it starts to shoot down your leg.
Yes.
Okay.
It's in my back and goes down my butt into my leg.
Okay.
Mm-hmm.
Does it always do that, or is it just certain actions that make it radiate?
It's been when I've been twisting or trying to bend over.
Okay.
Mm-hmm.
Are you doing a lot of motions like that?
Yeah, I like to play golf and do yard work, but recently I haven't been able to.
Okay.
Mm-hmm.
I'm sorry to hear that. When did it first start?
Started about a week ago.
Okay.
So.
Have you had any back problems before then?
It's been on and off for the past 5 years.
Okay.
Mm-hmm.
All right. When it's, in terms of how it's feeling, what does it feel like?
It's been sometimes sharp, sometimes dull, depends what I'm doing.
Okay.
Mm-hmm.
When it's at its worst, if you had to grade it from like a scale of 0 to 10, with 0 being it doesn't hurt at all and 10 being you need to go to the hospital, what is it at its best and worst?
5 at the best and 8 at the worst.
8 at the worst. Okay.
Mm-hmm.
When it starts to bother you, is there anything that usually helps you stop the pain?
Not really. Well, just rest and sitting, kind of.
Okay.
Yes.
Do you take any medications for it?
Not for the pain, no.
Okay.
Mm-hmm.
Are you taking any other medications?
Yes, I'm on Lipitor.
Okay, so you've high cholesterol.
Mm-hmm.
Okay. Do you have any other medical conditions or any past medical problems?
Well, I have shortness of breath sometimes when I'm doing my yard work, and I did have a stroke 3 years ago. And like you said, I do have high cholesterol.
Okay. All right. Anything from the stroke? Did you have any effects after that?
No residual effects.
Okay, great. Have you had any surgeries or anything in the past?
No surgeries.
Okay. Did you, for your back specifically, have you had any kind of testing done?
I had X-rays done, and they said I had disc degeneration.
Okay.
Mm-hmm.
Alrighty. Did anyone in your family, has anyone had any back problems or any other?
No, not any back problems.
Okay. Any other conditions?
Yes. Let's see. Oh, yes, my mother died at age 80 from lung cancer, and my dad died at 67 from emphysema, but my siblings are healthy.
Okay. Good. Glad we got healthy siblings.
Mm-hmm.
Alright. And then have you seen anyone else for this? Been to any other doctors?
Yeah, I go to the chiropractor once a month.
Okay. Is that helping?
Not really.
No?
It still keeps coming back.
Okay.
Mm-hmm.
So you said it starts to act up when you're gardening, playing golf. Is that what you like to do for fun most of the time?
Yes.
Okay.
That's what I enjoy doing.
Any other hobbies?
No, that's kind of it.
Okay. Have you been able to golf or anything since, or have you stopped doing that?
Yeah, I've had to stop just because standing and twisting hurts, so golf is kind of out.
Okay. So would that be something you're trying to get back to, a goal of yours?
Yeah, that's probably my main goal.
Okay. Any others?
And, well, just to stop the pain, I guess.
Yep.
Mm-hmm.
All right. Try and get you there.
Mm-hmm.
What about we talked a little bit about your family. Do you live with anyone? Do you?
No, my wife died 6 months ago, so I live alone and I'm retired, so
Okay.
I don't see people too much.
Have you you find ways to stay active, keep yourself happy?
Yeah, I'm doing okay. I guess I'm a little sad, but I would say I'm still in pretty good health, other than my back and my leg.
Okay.
Mm-hmm.
We're at home. So you said do you live by yourself?
I do live by myself.
Okay. What's your home like? Do you have any stairs?
I do have some stairs. I have 3 stairs just to enter the house, like from the garage.
Okay. Do you have any trouble getting up those ever?
No, not really.
Okay. All right. And then, so then just aside from that, do you ever get any feelings of like dizziness or?
No.
No?
No.
Okay. Any nausea?
No, nothing like that.
How about like you seeing okay? You hearing okay?
Yeah, I'm doing alright.
Okay. Any issues? Like headaches?
Nope.
Chest pains?
Nope.
Stomach problems?
Nothing like that.
Any weight loss, weight gain recently?
Nope.
Nope. Okay. All right. Sounds good.
Yeah.
Alrighty. Well, is there anything else you'd like to tell me before we start looking at you?
No. I just, sometimes I do wake up in the middle of the night just because I do have to go to the bathroom
Okay.
a little bit more than I used to.
Is that bothering you? Like, it seems abnormal for you?
It just wakes me up sometimes.
Okay.
So, but other than that.
Okay.
Mhm.
You staying pretty well hydrated?
Yeah.
Okay.
Yeah.
All right. So we'll keep that in mind as well.
Mm-hmm.
All right. Well, next, I'm gonna actually have you sit up if that's all right with you, so we can
Okay.
just take a better look at you.
Okay. Just right here on the bed?
Yep, just right there.
Okay.
Good. And you feel right there?
Yeah, I feel right.
Yeah. Okay. I'm gonna go ahead and put this gate belt on you first, just to be safe.
Okay.
It's gonna look great with your outfit, I promise.
Oh, thanks.
All right. So I'm just gonna wrap this around you real quick.
Okay.
A little snug. Just let me know if it's too tight or anything.
Okay.
Okay, does that feel okay?
Yeah.
All right. And next, I'm gonna pull that chair up over here, and I'm just gonna have you sit in that if you don't mind.
Okay.
All right, so you can stay right there.
Mm.
Just gonna pull this up. So we're just gonna stand up. I'm just gonna be right here just to check and make sure you don't fall or anything, and I'm just gonna look at your posture, how you're standing. So just once we stand up, we'll just stay here for a second, then we'll move over to the chair.
Okay.
All right, so whenever you're ready.
Okay.
Okay. Let's take a look at you. You feel pretty stable standing there? Okay.
Yeah.
All right, you wanna move over to the chair?
Sure.
Feel good?
Mm-hmm.
All right, let me take this off then.
Okay.
You feel safe there?
Yeah.
All right, great. Okay, so I I do want to take a look at your feet, so if you wouldn't mind taking your socks and shoes off for me, I'm just going to check for any kind of swelling.
Sure.
Perfect, okay. I'm just going to press my thumb into the side for a second here.
Okay.
Okay, I'm going to check this side too. Good, no swelling, we're good there.
Okay.
Okay, so I'm just going to test some range of motion next. So I'm just going to have you turn from side to side in your chair.
Okay.
Good, good, good. Any pain with that?
A little.
A little bit?
Mhm.
Okay. I'm going to have you lean forward. Good, lean back. Good. And then have you go to the side. And the other side.
Okay.
Good. Any of those bother you?
Just a little.
A little bit?
Just a little aching.
Okay.
Mm-hmm.
Alright. I'm going to go ahead and just test your strength with that. So I'm just going to push on you a little bit. Just try not to let me push you out of the way. So I'm just going to push on your shoulder right here. So
Okay.
don't let me break you.
Okay.
Good. Let me try this side. Or I'm actually going to push you forward. So don't let me push you forward.
Okay.
Good. And now I'm going to try to rotate you. Just don't let me. Same thing.
Okay.
Good. Go this way. Good. Any of that bothering you?
No.
No? Okay. Great. So next I'm just going to have you lift your leg up.
Okay.
And the opposite one. Good. And I'm going to have you kick your leg out. And back in as far as you can. Good. Same with the other side. Good. And then next I'm going to have you just turn your hip in. And now check back out. We'll do the other side as well. Good. Alright, so I'm going to push your leg up, or I'm going to have you lift your leg up just a bit.
Okay.
And try not to let me push you down.
Alright.
Good. And now I'm going to have you try and bring your knee, or you can relax through.
Okay.
And then kick your leg out just a bit.
Okay.
And don't let me push you in. Good. Now I'm going to pull you back. Don't let me pull you out. Good. And now I'm going to try and push you in, so don't let me push you. Or I'm going to try and push you in, you push out.
Okay.
So. Good. Don't push out this way. Good. We'll do the same thing on this side.
Okay.
So same thing, bring your leg up just a bit.
Mm-hmm.
Don't push it down. Good. And then now we're going to do your legs. So bring it just here and push it back. Good. And then pull your leg back here. Don't let it pull you forward.
Okay.
Good. And then I'm going to push it again. So
Okay.
don't let it push you out. Good. This way. Alright, next I'm going to have you bring your toes up, put them down, good, other leg, perfect, and now I'm going to have you lift it out to the side, good, and scoop it in, other side, toe out, toe in, good, and then lift your toes up for me, and scrunch them in, good, and just your big toe, if you can, good,
Yeah,
and
that's
lift
pretty
up. Alright, so I'm going to have you lift your foot up just a bit, and only push it down. Good, and don't pull you up. Good, do the same thing on this side. Good. Good. And now I'm going to have you kick your toe out. Don't let me pull you in. Good. And now same thing, don't let me push you out. This side, toe out, pull you in. Good. And now. Good. Lift your toes up. Don't let me push you down.
Hold.
Yeah, that's fine.
Okay.
Good. Okay. Other than that, great. I think I got everything I needed.
Alright.
So thank you for working with me today.
Perfect. I can put my shoes back on?
Yeah, well, I'll have you put your shoes back on. You got them.
Okay. Alright. So we're done?
Yep, we're all finished.
Okay.